You're listening to the Retina UK National Peer Support Group Summer Meeting recorded Thursday, the 16th of July 2026.
Good evening, everybody, and welcome to the Retina UK National Peer Support Group Summer Meeting. I hope you are all doing well, and boy, are we having a summer. I hope you're all enjoying this lovely warm weather. And thank you so much for joining us this evening, as it is another warm one out there as well. So I hope you're all keeping very cool indoors and also very hydrated. We're very pleased this evening to introduce our guest speaker, who is Eamonn Dunne, Campaigns and Policies Manager for Thomas Pocklington Trust, who's going to give an overview of his role and all the other support services that TPT can provide for those living with sight loss. So thank you so much, Eamonn, for joining us this evening. It's very much appreciated. Over to you. Thank you.
Thanks very much, and thanks again for inviting me along. I'll try and keep this interesting and interactive if possible, because obviously there's a lot of information to go through. I don't have a PowerPoint presentation, you'd be probably pleased to know. I'll start with me, and then I'll talk a little bit about the history of Thomas Pocklington Trust, which isn't that old. Then I'll say about the current services that we offer, and particularly probably say more about the sort of stuff that I do personally, because I'm obviously more aware of that and more passionate about it. So I'm Eamonn Dunne. I work at Thomas Pocklington Trust, which incidentally is going to change its name slightly this year. So we're going through a bit of a rebrand, and we're just going to be called Pocklington, just to save people time saying our name, because it's quite long. So we're just going to be called Pocklington by the end of this year. So I have worked for Pocklington for about 10 years, just over actually, and I've had a number of different roles within the organisation. I started off looking at what we call the England Vision Strategy. So that was very much looking at the eye health pathway, working across different parts of England primarily to kind of help join bits together, because as you know, and some of you may be aware of the eye care support pathway work that RNB are leading on, and all the sector partners at Retina UK have been involved in as well, just to try and make more sense of the eye health pathway and make it more coherent and support the connectivity between different bits of it that don't always work together well. So to make sure that people have the best possible outcome, both in terms of their health and their wider life as well. So that's where I started off. But more recently, I've been involved in the policy and campaigns work, specifically around health, which is my main focus is around access to health services for people who are partially blind or partially sighted, whatever that health service is. So eye health, yes, but very much around everything else, because people aren't just one condition. So Thomas Pocklington Trust, some of you obviously will know about us. Some of you have probably been involved with us, and I think some of you maybe even Sight Loss Council volunteers. But we're a UK-wide sight loss charity, mainly focused in England, but we now have activity in Scotland, Wales, and we're looking at Northern Ireland, which obviously is a bit more complex because it's across the river, a sea rather, and also they have a very different setup in terms of health and social care over there. So, but we are looking at that because we want to try and be a coherent UK charity. So we work together with blind and partially sighted people to drive social change, particularly in education and employment, are the two areas that we've expanded on. I'll go into that a bit more detail about that in a bit, but also very much around everyday life, which covers everything really. So, you know, in some part of our organisation, we'll be looking at retail, we'll be looking at, I'll go through the details of the sort of areas we look at, but it's pretty much everything everybody might want to be interested in accessing really. So nothing is out of bounds really. So the history of our organisation, we probably won't surprise you to know that we're named after our founder, which is Thomas Pocklington. And Thomas Pocklington was a London merchant. He was quite wealthy by the time he died in 1935. He started off, he had lots of different interests. He's one of these people who just does everything. So he was a watchmaker, an engineer, an investor. He's very interested in acquiring property as well. Very successful at it, I have to say, what I'm glad about, because his property portfolios helped to fund a lot of the work that we do over the years. So very grateful for that. His reason for his interest in sight loss is an interesting story. Some of you may know. So he was out, and again, I'm not supporting any of this sort of reason behind this, but he was out shooting, and his chauffeur, well, I think he was loading a gun or something, but he accidentally shot him in the eye. Or in the face, and he lost the buckshot, kind of caused him to lose sight in both his eyes. Fortunately for him, he was able to have that repaired, which, in those days was quite something. But so his temporary experience of sight loss had such a profound effect on him, and he experienced the lack of support that was available in those days for people who had eyesight problems or no vision or whatever. He was very inspired to do something about that. So in his will, he left a great deal of money and property portfolio for something to support people with sight loss. He didn't really have a clear idea what that was at the time, but these trustees were sort of established to enable that to happen. So after his death in 1935, the money was kind of held, and there was some contest to the will from an ex-wife or something. But long story short, in 1958, there was a charity was properly established called Thomas Pocklington Trust. And it's evolved very much away from the original activities that the charity was involved in, which was essentially grant making and housing focused. So it was about providing housing for people in safe spaces and support with various adaptations, but it was very much focused on that. And now we do, I'll go into what we do, but inclusion, very much important focus for us, education, employment, and accessibility to everyday life and influencing policy. So we do quite a lot of work influencing the government where we can, and supporting parliamentary work to bring forth the issues that we think are important for politicians to be aware of. So now we have a base in London, but our staff are based all over the country. I am based myself in Northumberland, which is a hell of a long way from London, I'm most in Scotland, actually. Don't know where all of you are based, but probably scattered about the country, I'd imagine. Things like this, Zoom, Teams allow us to work remotely far more effectively than we used to. So it means that we can engage locally and then use that experience to influence things nationally. So it's very useful to be able to do that. So what we're doing now, what are our activities? Again, some of you will know this. We have a very big team now. We work with guide dogs on this, on education and student support. So that's an area where in the past you have experience in your lives of education, possibly not being as good as it could have been, depending on where that was. But we do a lot of work with specifically with students themselves, so people entering higher education or further education. But we also work with parents and carers as well of younger children, because a lot of them have difficulty navigating the systems of support. They feel isolated, and because of the relatively small number of children with sight loss compared to the number of adults, it's harder to access support in various parts of the country, particularly. We also work with education professionals as well to make sure that that they have access to the right information, particularly with educational support. Because of the challenges with education and the numbers of teachers and number of the budgets available to schools to have support workers, there are often problems that we help to kind of resolve on a case-by-case basis, as well as influence at a national level to make sure education policy is fully inclusive. So education is a very big part of what we do, and like I say, we work with we host some of Guide Dog's staff now to provide this support to people, because we're covering a big patch of the country. We want to make sure that we've got plenty of people available to help. So that's been really successful. It has expanded quite a lot over the last 3 or 4 years, and we have really good outcomes from that now, and a really established service. So if any of you know anybody who needs that service, please refer them. Moving on from education, employment is another key area where people with sight loss might struggle to get the right support. There's an awful lot of bias out there. There's an awful lot of assumptions about people, and getting employment, we know from this data, is actually quite difficult for people. That the percentage of people unemployed who are blind and partially sighted is actually higher than the average rate for someone with, say, with disabilities, if I can say that. So there are particular structural barriers and attitude problems with employers, and all sorts of other barriers that get in the way of people fulfilling a career that they want to work in because of often because of preconceptions, to be honest. But obviously technology is an enabler and a barrier. So what we do with employment is we help people on the kind of the basic stuff that you'd imagine. So CVs, application support, all that sort of thing, interview prep and coaching, careers advice, obviously, because there's a tendency with central careers advice to put limits on people. We don't put limits on people. Whatever you want to do, we'll help you to achieve it. Access to work schemes. I don't know, some of you will have experienced access to work and all of its problems. It's a bit of a minefield trying to get support for people to have the adaptations to a work environment. Oftentimes the employers are a bit of a barrier in that because they don't really understand it at all. They just see challenges rather than opportunities. So we can help with that. We can help with advocating for people who are trying to access the access to work scheme to enable them to go into employment. And also, working directly with employers, particularly the larger employers, to make sure that they've got everything in place. Many of them do now because of the Equality Act, but again, a lot of individuals may have preconceptions that we help to disavow them of. One of the biggest parts of our employment support service now is our internship program. So that effectively is we have a paid internship program. So we recruit people who want to kind of go into some kind of profession. It doesn't matter what it is. We host interns ourselves, so do RNAB, but we also look for employers. So if someone wants to get in a particular industry or sector, we will search out contacts within that sector to enable them to get an internship within that organisation. So that could be anything from Moorfields Eye Hospital to solicitor's firm to a technology firm. Whatever someone wants to do, we'll do our best to get them into that sector, because like I say, we don't limit people's ambitions, and that's been really successful. And I was really proud, as was Bhavini actually. It's a shame she's not here to tell you, but the other week we attended a sort of celebration of the interns, and we had, I don't know how many were there. There must have been at least 60 interns that we had, who all worked on individual projects in groups to do various things. And the one that I sponsored, they looked at the emotional impact of not having your reasonable adjustments met when you're using healthcare. So oftentimes when you're using healthcare, you don't get the information in the right format for your appointments. When you turn up for an appointment, people don't really understand that you can't see signage, or you don't know where room 5 is, or so you maybe need sighted guiding. So they were looking specifically or more at the actual, how does that make people feel, rather than the technical side of it, although they did look at that. And things like the NHS app, access to that, how difficult it can be to get to use that. So all of that sort of stuff they looked at, and that was really good. And the day was amazing. But what was so impressive for me was the range of skills and the ambition and the sense of humour and the kind of positiveness of all of the interns as they then move on to go into their places of work after that programme. So that's really important, because that's not just about giving advice to someone, it's actually actively supporting someone to achieve their ambitions. And that for me is one of the proudest days I've had working for Thomas Pocklington Trust, just to see all of that, really. Really impressive. So we looked at education, looked at employment. Another area that we look at is access and inclusion. So this involves like campaigning work, creating training resources, and engaging with services around transport, retail, digital services, and actually the public realm, the built environment, as it were, because all of these areas can be difficult for people to navigate, not because of the people, it's the actual service and the fact that it's designed for people who can see, not for people who have access barriers or other disabilities. So we do a lot of work with transport providers. I don't do this, so I don't know as much about it, but I know that we do engage with rail operators, bus operators, and they're looking at taxis, these new taxis now that are driverless and all that. So we don't limit anything that's sort of under the banner of transport. We'll look at it. Retail's another one, because people should have the right to kind of go and access shops, not just online, although that's obviously beneficial. So we work with retailers. Now, the previous role I had within Thomas Pocklington Trust, I worked in the local area that I'm in Northumberland, working with a local retail park, just to kind of discuss some of the challenges of getting around that retail park. The sort of physical barriers that are often in the way, like those yellow triangles that people put out when there's a spillage or something, or there's been rain on the floor. They put those yellow triangles out to warn people the potential slippery surface, and just leave them out all day, much longer than they need to. And then obviously they can get in the way. You can trip on them, catch your cane in them, or just fall over them. So we look at that as well, trying to get them to kind of understand the implications of those barriers for people. And those kinds of things are really good, because when you engage with people, we always find that they want to do something about it. They just weren't aware. It's not deliberate that they put these things in the way. It's just lack of awareness, really, and lack of training. Public spaces, again, that's a difficult one, because we try to get involved when there's any sort of building refurbishment or public realm works going on. We'll where we can locally, we'll get involved in discussions around where things are placed. There's a huge debate going on around shared spaces. I'm sure some of you will be involved in that or have heard of it. These sort of shared spaces, floating bus stops, and all manner of wonderful integrations of different transport modes together, which I don't even know who came up with this idea, but it's quite frankly ridiculous to mix people with traffic. I don't know why that was ever a good idea, but clearly it's not something that we'd advocate. So that's it. We get involved in those debates as well. So I talked about site loss councils, and this is a particularly important area of our work that we've expanded since I've been at Pocklington Trust. And it's about trying to create sort of a groundswell of people in local areas. So we've got about 25 site loss councils now, some in Scotland, and we've now got one in Wales as well. And site loss councils are regional groups of partially sited volunteers managed by a paid manager. So Thomas Pocklington Trust funds the cost of the site loss councils. And the purpose of them really is to ensure that people with sight loss have a strong voice locally in shaping services. So we do a lot of nationally, but I think it's really important that we support local work in this area so that people can work. I know that charities like Bardet-Biedl, have withdrawn somewhat from local services, maybe when they were Action for Blind, and they had lots of more local presence, really, and more people on the ground to kind of help with where there were problems. But they've obviously retreated a lot from that for one reason or another. And most of their services now are direct services, are on the phone or virtual. So really, we think it's important that people are supported locally, because that's where people are. Your problems exist where you live. Yes, there are national reasons why that are, but if there's a problem with a local service, it's good to be able to find a way to get people involved in fixing that. And there's no substitution for lived experience to inform. I do a lot of vision impairment awareness sessions with different parts of the health service, and that only works because I always have someone, either a volunteer or a staff member, who is visually impaired and is able to kind of articulate their experiences, and that resonates far more with people than me just giving them statistics or whatever. So that's a key feature of sight loss councils, is that everybody who works in the sight loss councils or volunteers for the sight loss councils has that lived experience, and also life experience, because they've all been involved in different sectors or careers, or they are involved in them as it was now. So we have all manner of different professions involved in the sight loss councils. We even have some social workers, some eye clinic liaison officers, some social workers and rehab officers, and all of those professions that it's useful to be involved in that as well. But they'll work on anything, really. So there's a menu of possibilities that we give them to work on if they want some advice or support centrally. But it's whatever's going on for them locally. That could be transport, so rail stations, buses, wayfinding, all of those things that people need to know about on a daily basis. Again, streets and public spaces. So different places have different issues, really. There'll be some places where there's a particular issue with a town centre, or pavement parking or whatever, and so people can work directly with local authorities and other charities, maybe combine together to kind of fix some of those things. I've mentioned health and social care. That's again something close to my heart. We have people maybe who have been involved actually in the health sector, maybe in a careers, and they've retired, and now they're sight loss council volunteers, and they have that expertise and contacts within that service as well. So they're really useful to be able to kind of help make change in that particular area, because health is one area where I don't think my job's ever going to be done with trying to make health more accessible and better for people. And then retail, but it could be anything. It could be a local theatre that someone wants to get involved in making more accessible, or an art gallery. Doesn't matter, whatever it is. If it matters to someone, then it matters to us, really. And that those sight loss councils are growing all the time. We'd like to cover the whole of the UK completely. We're not anywhere near there yet, but we do have a great deal of coverage. And those sight loss councils will work with local sight loss charities and other stakeholders in the area to maximise the impact of their work. But like I say, we support them centrally. So if there are any resources that they need, or policy documents, anything like that, or they want information on the law in those particular areas, we help with all of that as well to make sure that they're fully up to speed. So I'm now going to move on. I mean, by the way, if anyone needs to go make a drink or go to the loo or anything, please don't feel like I'm not going to get upset if you suddenly disappear, because we've all had a long day probably, and it's not very the heat as well as kind of affecting everyone's ability to kind of cope with things like this. But on health, so for me, when we started looking at health as an organisation, obviously our first port of call was eye health, because obviously we're a sight loss charity, so no surprises for guessing that. And we work with RNIB, Retina UK, Macular Society, and other sight loss charities to kind of make sure the eye health pathway is as good as it can be. Still a long way to go, but we're doing our best on that one. But I think for me, one of the gaps in what we were doing, well, there was two gaps actually in what we were doing. One of them was about looking at trying to reduce avoidable sight loss, so getting people to have regular eye tests and getting people in front of optometrists or other eye health professionals if they did have anything, there were any symptoms of eye ill health. Because I think soon is better, isn't it? Whether that's something that can be a condition that can be improved or arrested, at least the degeneration can be arrested, or it's the ability to do your daily living. So it could be simple as, I think there are 2 million people in the UK with sight loss, as far as RNIB have kind of stated. About 40% of those people could have their eyesight improved by glasses or lenses, but they haven't been to an optician, or they haven't actually got the glasses prescription that they've been prescribed. So they're functionally living with lower vision than they need to. But that's a lot of people. So we work with Age UK to try, because most people with sight loss are older. About 80% of people living with sight loss, we think, are over 65. So obviously that's an area of focus for us. And Age UK are an organisation that works with that demographic, so it makes sense to do some work with them. So we do that. But it isn't just older people, it's everybody. And trying to encourage people, especially, if you're over 60, eye tests are free, or in Scotland, they're free for everybody. So why wouldn't you go in for an eye test if it's free? You could actually pick up other health issues as well as just your eyes. I think, but for me, one of the biggest areas that I'm working in is removing barriers to healthcare, which you'll all have experienced on a regular basis. I'm sure some of you, will have better experiences than others with getting information in the right format. And again, having that consistently, you might get things from one place, one part of the health system, but then when you go to the hospital, maybe that service doesn't provide accessible information for you. You might not have reasonable adjustments made, so you go into a GP or a clinic and there's a screen to log yourself in, which has no tactile feedback, or you may not even be able to see where it is. So there are all sorts of issues with, as the health service particularly modernizes and gets more digital, it's not getting any better. There are things there. So in order to do that, we do a lot of work with local health services directly, but also by producing guidance as well. And one of the areas that we've been looking at a lot is health screening. So again, you will have all had different opportunities to use health screening services, whether that's bowel cancer. So the kits, when you get to 50 now, you'll get a kit sent out to you to collect a sample of your poo. Well, if you can't see very well or at all, that's really difficult. So we've been working with NHS screening services to improve the accessibility of that kit. And there's a new kit being rolled out round about now, actually, across England to start with, which is still tricky to use, but it's a lot better. And the instructions are, to use them is in different formats. And so we've looked at the whole process involving people with lived experience to improve that. We've also just released, in conjunction with NHS, a learning platform for staff working in breast screening services as well, because that's another area where women have told us that their experience hasn't always been good. So this learning module hopefully will address some of that with the staff, and they'll kind of know about accessible information standard. They'll know how to talk to people and how to guide them through processes more effectively, and things around making a clutter-free environment in any kind of clinic. So all of those things there, which are standard things that we say to people, but we've actually got some of our staff actually with lived experience of using those services actually popping up throughout the learning, saying what's important to them, because we do feel lived experience is key. It's key to any of this information. So that's been really well received. Another area where we're working around health is mental health. So the incidence of depression, anxiety, and other mental health conditions is generally higher amongst people with sight loss in the general population, and that might be unrelated to the sight loss, but in many cases it is related to them not having the support through either the point of diagnosis, but more often than not, it's not just at that point which people need that support. Some people don't need as much support as others. Many people aren't aware that there is even support available, or they might not recognise that the challenges that they're facing are actually to do with their mental health or emotional well-being. They might just think, well, that's just the way it has to be, so I'm going to have to just get used to it. But I think, adjusting to a life, especially in later life, if you start to lose your sight, it can be obviously very challenging, and I'm sure you've all got experiences. And depending on what support you've got in terms of your family or friends or your sort of social network, you might need more support than other people. But I think what we think is that people should be at least offered that support, various points along there. So we looked at where were NHS services just to see how accessible that they were. And we found quite clearly that they're not accessible. So we're working with NHS again on a service they have called Talking Therapies, which Talking Therapies is an England only sort of service, but it sort of is usually people's first port of call if they're experiencing anxiety or depression. You can self-refer to Talking Therapies, but oftentimes you get referred through a GP or some other local healthcare primary care service. And Talking Therapies is, it's kind of depending on where you live, there's different waiting times for it, but it's basically, a therapist or a counsellor addressing some of your issues by talking to you either directly or over the phone. There are various web resources as well people can utilize in terms of that to support that work. But what we found was not only was where the service is not accessible in terms of the information, so you oftentimes, the process to kind of refer yourself would not be accessible, and then you'd be given information leaflets and all sorts of other things, but in a format that you couldn't actually read. So that was one problem, was the kind of accessibility. But the other problem was that therapists weren't experienced or trained in the impact that sight loss has on mental health. So they were having to kind of guess really and spend some of the time trying to figure that out, when really, that should be part of their professional qualification. But we're now working on a positive practice guide that will provide that service with all of the things which they should know about, and also making sure the service is accessible as well. And that's in conjunction with RNIB and the NHS, and that guide will be launched later in the year, and hopefully again will improve people's experience of those services as they go on. One of the problems with that service was they didn't even know how many people that were getting referred to them did actually have sight loss. There was no figures on it. So if you don't know how many people and you can't identify those people, then how can you possibly support them in the right way? So that was part of the point of doing this positive practice guide. Health, we look at other aspects of health as well. So any service that, there's one experience that we had in Cheshire, near Merseyside, where someone was admitted to hospital, and they were left for about 8 hours without any support. This is, I mean, we hear these things happening, and we wonder how. And then hopefully they're rare, but the impact these situations have on people is massive. So this woman was left for 8 hours. I think someone came in halfway through the shift and left them a sandwich, but didn't tell them where it was. They weren't able to access the call button within the room they were in. And obviously, the hospital, when this came out, and the hospital was there's a press article, and there was a lot of people kind of sort of nasal gazing about how could this possibly happen. So what we're doing with our Merseyside Sight Loss Council is looking at a checklist, so that when someone's admitted to hospital, and they have, an eye condition or other, maybe hearing loss and all the conditions that affect their ability to be independent within that service. We're looking at a checklist just to make sure all of those things are in place. especially when there are shift changes. And one of the things that we found in hospitals is you might have really good support from the staff on that service if you're an inpatient, and then the shift changes, and then the new staff don't know all the things that because it's not written down anywhere, and it's all word of mouth and stuff. So we're looking at this checklist, making sure that when someone's in hospital and the shift changes, that the new shift, the new staff have access to that checklist to make sure that people are getting everything they need and not ignored. So that's another example. But there are many other things which come across my desk, about health, related to health, that we either try and intervene directly, or we refer on to someone else, or we at least provide what guidance on what should be happening within that service. So, but that's the area that I work in. So that's the area I've got most knowledge and passion about, really. So as well as health, education, employment, engaging with the sight loss councils, we also have a grants program. Now, going back to what I said, I'm just going to have a drink, excuse me. Going back to when I started talking about how we're funded, because we are funded through the income that we make from the investment that the charity was established with. We don't have to fundraise, which I'm very grateful for. So unlike RNIB, Guide Dogs and other charities, we don't have to go shaking tins or fundraising, or like most charities actually do. And that allows us then to not only fund the work that we do, but we've also got a small grants program. And that those grants we've evolved them all the time. They're never. Each year we'll have a new grants program to fund something different, and we try and respond to where there's the most need. So, for example, during COVID, we were in a position, because we work very closely with Visionary, Visionary is the organisation that supports the smaller sight loss charities across the UK. Because of that relationship with Visionary, and through Visionary, all of those sight loss sight loss charities, we were able to very quickly get some funding out to those charities who were all experiencing incredibly difficult situations where suddenly everyone was have to stay at home. So they needed computers, they needed access to technology, they needed to fund new ways of working. And so we were able to very quickly get a £10,000 grant out to all of those charities that asked for that, through a very, very short application process, because we already had that relationship with them. Because they recognised they needed it quickly. So that for me was one of the in terms of responding to need, was one of the most important things that we've done for a while, actually, because that allowed them to maintain a service to people. Because I shall remember, everything just hard to imagine now. It seems like ages ago, and we've all got back to post COVID world, but it had a profound effect on everybody, and those sight loss charities needed to still keep delivering services, but they had to change. So that was one thing. But we also fund research and various other bits of work that come along. We don't just fund anything. It has to have a particular resonance. So we try to fund things that have big impact, so that's why we do things like positive practice guides, and not one-off things that are going to lead to lasting change, really. So another aspect of particularly what I do is around influencing the government. So we have a lot of a sort of a process where we'll have all of the MPs. We've got all the MPs' details. We engage with MPs in different areas, and particularly around government ministers as well. So we fund something called the All-Party Parliamentary Group on Eye Health and Vision Impairment. And that sounds a big description, but basically that's a group of MPs chaired by a woman called Marcia de Cordova, who is MP for Battersea in London, but she also used to work for us. She's also visually impaired. And she chairs a group of different politicians, and also that work on different things like employment and specific issues, and host various events in Parliament to get more visibility with MPs that come along, and to find out what's going on, and see where they can help to make the world more accessible. We'll do campaigns, basically, things like access to work. We campaign on student allowance, all of those things that fuel what we do. One of the things that we're looking at is personal independence payments. Obviously, like a lot of sight loss charities and other charities are looking at making sure that personal independence payments deliver the best they can for people, because there are always threats to these services. So we need to make sure that they're on everyone's agenda. We attend party conferences as well. So unfortunately this year, I don't know, I shouldn't be political about it, but I'm going to the Reform Party conference just to see what they're about in terms of the health and the other policies that they may have that impact on the people that we support. So things like, equality legislation, diversity, all of that sort of stuff, particularly under threat. So we have to kind of, engage with all politicians regardless of their policies, because who knows who's going to be in government next. I mean, it's a very volatile political landscape that we inhabit. So we need to make sure we're across all of those different policies, and influencing them where we can. So that's the kind of at that level. So we work on a number of different levels, and it makes life really interesting. So that's us in a nutshell. We have an office in London, like I said, and that office is open. So we currently hosting Deafblind UK in our office because they needed some space to work and they didn't have anywhere. So we host Deafblind UK staff as well. Now we're in the same building as Blind Veterans. We work, across. I have lots of contact with people in all of the sight loss charities, some local, mostly national. So we're a very kind of harmonious bunch most of the time. We get on quite well. We all do slightly different things, but we work in harmony. So that's really important. One of the things which Bhavini was going to talk about, actually, just before I see if there's any questions or comments, was Listening Month. So we know that Listening Month is July. So that Listening Month is basically where we ask blind and partially sighted people to complete a 10-minute survey. It's available online, which I can send to you, Mark, and you can send that out to people. It's a Microsoft Forms thing. So apparently it's accessible, it's been tested. So if it's not, please tell us. And it gives you a chance to tell us what matters to you most, because I think we can make all sorts of assumptions, like the issues that I've explained, but there may be other things which you're facing that we're not addressing, whether it's wheelie bins or shared spaces or whatever it is that niggles you in your daily life. And that's an opportunity for you to tell us maybe what's important to you that maybe not being addressed, or maybe it is being addressed and you're not aware of it. But just if we have those issues told to us, then we can respond to that. So please do, if you can, complete that survey. I know, I'm sure it'll be sent out to you. Like I say, it takes 10 minutes. It says 10 minutes. I don't know. I haven't actually done the survey, so I'm not quite sure how long it takes, but I believe Bhavini when she says it's 10 minutes. She's not known to lie. So yeah, if you could do that, because we can make assumptions, we can base it on what we know already, but it's really important to keep that as a live conversation, just so we don't miss things. So we pick up what's important to you guys out there. So yeah, so I think I'm going to shut up now because I've talked quite a lot, and my throat's getting dry. So please, any questions, thoughts, comments, clarifications required, whatever, please do ask.
Thank you so much, Eamonn. That was just amazing. I didn't realise. I've been to TPT on a couple of occasions, and I've never known you guys to do so much and cover so much across the UK. It's amazing. And thank you very, very much for what you do for the sight loss community. It's brilliant. Does anyone have any questions that you would like to ask Eamonn? Any hands up?
Yeah, Keith, Mr. Baker.
All right, thank you. Well, I was just going to say, I used to listen to Bhavini's webinars, and Jonathan Ward, another chap who was very, very helpful to me, but they seem to have disappeared. I don't see much of Bhavini now, or Jonathan Ward. And I've got both their mobile numbers. I did try them, but I think things must have changed, and I haven't been aware of it. But I just wish them well anyway. They were wonderful hosts. Helped me in so many different ways. They taught me about Pathway, ECLO, PALS, all sorts of things that I'd never been aware of, except for them. So in a way, just thank you to all of you.
Oh no, good. Well, I mean, Jonathan's very much involved in the employment program. I think we've evolved over the years because we keep sort of trying to check with people what's the best thing we can do. Where can we put ourselves that's going to give the best value to people? And again, we don't know from day to day. I get all sorts of emails forwarded to me around very specific issues or questions that people have, and I never, even if they're not about health, I'll find a way to answer those questions. But then we've tried to kind of focus on things like education, employment, technology is one area that we're looking at, particularly around health. Actually, it's an important area. But I think if you have any questions like that, please do contact us. If you can't get an answer from anyone else, you will get an answer from me. So I'll put my email out, even if it's not me that can answer your question. I will make sure you get an answer. Because I always, one of the things I pride myself on, as it were, is never leaving anybody hanging about anything. Even if it's nothing to do with the work I do, particularly if it's an issue that someone has about living with sight loss in a world that's not designed for them, I will find out. I am known for my dogged determination. A lot of the projects I'm involved in health have taken 18 months to 2 years, even of me constantly badgering NHS people in NHS for an answer, and I don't take no for an answer. So we'll always find something, even if it's not the answer that you want. We'll get you an answer. But no, thanks. It's good to know that, because we do pride ourselves. And I know that other charities, and we've had criticisms about some of the things that we've done in the past, and that's fair enough. We're never perfect, but I think things like Listening Month allow us to kind of just do a sense check really on the things that we're doing, because we evolve in response to what we can detect people need, and what the world's telling us. But we don't hear everyone's voice all the time, so it's important that we get as many voices and try and find common themes. And we can't do everything all the time everywhere, but we'll do our best to spread ourselves out. And if there's still a need and a gap somewhere, and one of the things around rehabilitation services, so Scotland, for example, we part funded rehabilitation courses at Glasgow Caledonia University, because during COVID there was nowhere in Scotland that you could train to be a rehab officer, and there's a huge shortage. Some of you will know more about this than others, I guess, but there's a huge waiting list for vision rehab services, and the quality is so varied, and I'll name and shame one area that I know quite well is really bad, is North Tyneside, for getting rehab. So you have to wait a long time, and when you do actually get some support, it's very minimal. It's it's basic stuff, and here's a bag of puns, and there's no, if you need anything, it's not really quality at all. So those are the sorts of things really that we try and either deal with directly or try and campaign for. Yeah. Oh, Stuart, you've got your hand up.
Yeah, it's a question about, you mentioned sight loss councils. Is that a Thomas Pocklington Trust initiative, or are you supporting another group? And how do I find out if there's one in my area?
There's sort of, they're part of Thomas Pocklington Trust, but they have a sort of separate identity, just to kind of give them their own sort of identity. But they're funded, and the employees that manage those on the local level are all paid for by Thomas Pocklington Trust. So they kind of are part of us, but they've got their separate sort of brand, if you like. Where do you live? What area?
Monmouthshire, South East Wales.
South East Wales. There is a Welsh Sight Loss Council, and Anita is the
Anita Davis.
Anita Davis, yeah, she coordinates.
So the one. Okay, so we have Wales Council for the Blind.
Yeah, but she coordinates the Council for Wales as well. So
right.
If you've got her contact details, ask her about it, because we've spoken with Anita and stuff. So I support some of the work that Sight Loss Councils do in terms of health, and they have a subgroup. The Sight Loss Council for Wales has a subgroup looking at health. But contact Anita, and she will.
Yeah, I know Anita. I met her a few months ago in a meeting. Yeah.
Right, smashing. Yeah, plus she'll tell. There's a website as well. It's for Sight Loss Council, a separate website that has a lot of detail on the types of projects. So if you have access to that, I suggest have a good look around that, and you'll get a bit more information on the sort of things that they get up to.
Okay, thank you.
And we have just on Sight Loss Council, we have a conference every year. Or I think it's every 2 years now. It was every year, but it might change to go back to yearly. But the Sight Loss Council conference brings together all of the Sight Loss Councils. The one we just had has been in Leeds, but they've been in Birmingham before. It's hard to find a central point for the UK, because it's going to be difficult for some people to get to. But that's where we bring it all together, and there's over a couple of days with lots of fun. Some drinking, I think, as well, but lots of fun, and people get to share their projects and ideas and learn from each other and inspire each other, and they're amazing. I've been to one, the very first one actually, and that was just exhausting in a good way, but there was so much going on. I was so proud to work for this organisation when I saw all of those people stepping up and doing all these amazing things to make things better for people, just purely out of that motivation, just to make things better. It was just amazing. So being part of that Sight Loss Council movement's a really powerful thing.
Excellent.
Okay.
Thanks very much
you.
for your question, Stuart. Eamonn, you've mentioned that lots of information is on the separate website. If it's okay to share with me perhaps this website and also if there's a list of all the sight loss councils across the UK that if anyone is interested about getting involved with their local sight loss council, and if anyone is interested, because we do support community in Northern Ireland as well, and if you know when you guys decide, or if you need any support, you know, we do have a community that might like to get involved in supporting you with Belfast or Northern Ireland sight
I guess we'll need that. Yeah, because same in Wales, it was the Wales Council of Blinders have been very supportive in getting the sight loss council set, because we work same in Scotland. We work with the sight loss charities in Scotland, the Sight Scotland, and I forget the names. They're all very similar sounding names, some of these sight loss charities, and they all get mixed up in my head. But the two major sight loss charities in Scotland, we work very closely with them, because I think, you know, we have to do that, because you know, we need to make sure that we're, you know, working in harmony with what's going on, trying to do something new. Because I know that, you know, and I know people have criticised RNIB in the past for doing this, but we don't want to parachute in solutions. It's you know what's got, you know, those sight loss charities locally will know what the issues are. We just want to augment and add value and support the work they're doing, because, you know, it's hard to do everything, especially with limited funding. And we know a lot of local sight loss charities are really struggling just to survive, and some of them have gone under, you know, like Vista in Leicester recently has had to transfer its services over to BID, and, you know, drop a lot of the other things that it was doing, because it's difficult to get funding to maintain, you know, because the way funding's offered, it's often piecemeal and project based, and people don't get money for the core services, you know, so they have to take staff on for a while, and then when the project ends, the staff member goes, and it's just terrible, really. And it's a fundamental flaw with the whole way that the voluntary sector is funded. But, you know, that's an argument or a discussion for another day, I guess. But the point is, you know, where we can, we'll go in and augment and help, and, you know, certainly not trying to displace anything, because if we ever feel we're displacing something, then we've failed miserably. So if anyone ever thinks that's happening, please let us know, because it's not our intention. It's just that, you know, we know there's an awful lot that needs to be done, and we're trying to kind of work in harmony with others to do that. So, but, you know, we're not always going to get it right. We're going to make mistakes.
No, that's absolutely brilliant. Has anyone got any final questions? Because I have another one, but if anyone has any other questions that you'd like to share, well, I think we're doing okay for
got 5 minutes.
5 minutes. Yeah.
I mean, particularly anything around health. So if you experience anything around health services that isn't great, and you struggle to get a remedy, or, you know, please contact me, because I'm really interested, because I only know what I know, and, you know, there are things which I learn from what's going on locally that are actually part of a much bigger problem, and only by knowing those individual circumstances do I have that insight into where the problem might actually be. So please do forward it, or, you know, anything you observe out there around health, access to health services or social care, you know, it would be really good to know about those things.
No, that's brilliant. Also, obviously, the question I was around technology that is supporting the visually impaired community at the moment, in specifically the smart glasses and wearables. I heard about a scheme, and I need to follow it up from the Kent Association for the Blind, where I'm based, that they will be supporting those that are wearing the Meta Ray-Bans, Oakleys, and any other type of smart glasses wearable that look like normal glasses or sunglasses. Because there have been reports where blind and visually impaired people have been ordered to remove them because of their recording capabilities. And most recently, I think it was a British Airways flight, someone actually said, you know, in the flight attendant said, can you please turn off all recording devices and remove and shut down, and that includes that includes smart glasses and the Ray-Bans. That wouldn't work for someone that's visually impaired that actually needs them to be able to navigate. So they're actually advocating for an ID card of some sort that kind of gives us veto to be able to use these glasses 24/7. You know, is TPT heard anything like that? And, you know, would they be kind of getting on the advocacy support train across the UK? Because we've got this amazing technology, but then it's not going to be great if we're only allowed to use it in certain places and in certain environments, like a bank, for example, you know, or an
Yeah.
airport or a shopping centre where you're not allowed to film or record.
I think yeah, we're not involved in anything massive on this one, but I know going back to Jonathan was mentioned before, and Graham, who work in our employment team, but they also very much focus on technology. So they're aware of these things. We've tried them out. So I guess that would be, you know, if you want me to put you in touch with probably
Yes,
Graham's
please.
for that one, I'll give you his contact details. But
Yes,
so we're not
please.
doing it. But that's a really good example of where technology or the policy hasn't kept up with technology. So these new devices are coming out, and there are concerns of privacy, you know, because there are genuine concerns on privacy, people's, you know, access to certain, like maybe in schools, or women might feel comfortable with someone wearing quite justifiably. So I think we need policy, and there's no policy in this area. So that's something where, and I've mentioned it actually as TPT internally about that as well, about, you know, because half of our staff are visually impaired. So, you know, many of them will want to use this technology, but, you know, we need policy on it to make sure that we protect everybody. So those people that want to use the technology because it's brilliant, but also maybe to protect people who feel this technology might make them feel vulnerable, which is, I say, is just as valid. So it's technology evolving into spaces where we don't have policy to kind of manage that. So, and all these tensions need to be worked through so that people who have a genuine concern for their personal space, their issues are discussed in terms of the kind of impact that might have on someone's ability to have equitable access to a service. You know, all those things come together, and there is tension between those two things, and it's not always very straightforward. So companies like British Airways and other companies, really customer service companies that aren't aware of the kind of, you know, how these things might be used by people who are blind or partially sighted, need that education, and that's a big job to do, you know, because there's a big discussion, because they'll have blanket policies that will just say, I'm sorry, I don't care what you're telling me about how you need this for your equity of access. I'm not interested in that. We have a policy, and the policy is this, so, you know, turn them off. So again, you know, it's a bit like guide dog refusals and all that sort of stuff. You know, these tensions that we come up against with you know, either guide dog's not a technology, but it's a kind of it's a resource that enables people to have equitable access to the built environment or to navigate spaces. And, you know, some people who offer those services or who manage those spaces won't have any knowledge about that, you know, and that's often just a staff training. It's looking at the law, to what does the law allow, and making sure people are aware of their rights. But smart glasses and this new technology is this uncharted space, really. So yeah, but it's interesting you mentioned that, because that has been something that I've wanted about as well. But I'll give you Graham's contact details, and he'll kind of give you the latest on that, really. But I don't think we're not doing anything massively on policy yet on that, but we may do.
Yeah. Do you think it's actually because the Ray-Ban smart glasses, and even going back to the Google Glass, we're talking 2016, that, you know, got smart glasses have been around for 10 years.
And your Cam was another example.
Yeah,
sort of
all
thing.
cams, you know, they've got I don't think they've got recording capabilities, but they definitely have scene description capabilities and you know, sort of OCR recognition and stuff like that. So they've been around for a long time. You know, do you feel that there's no policies regarding smart glasses is kind of like, well, we're just not interested in this technology, or making it viable and safe for those, you know, and free for people to use this technology. I mean, when I say free, I mean the freedom to be able to use this technology, just like someone should have constant freedom to use a guide dog, because that's now the law. You know, you can't. But, you know, is it just taking to some of us, it's quite slow, you know, to get advocacy policies out there for the visually impaired. But, you know, anything that you know, your tech guys, I would love to have a chat, you know, and if there's anything that I can actually help, or anyone else that, you know, utilizes this smart technology to help them stay independent and mobile, and work, education, etc., you know, we would love to get involved.
Yeah, I think with the smart glasses, they become far more mainstream and less obvious. So like the Orcam and things like that, although say that they didn't actually record, so there wasn't the same issues, but they're not so obvious. You can't even tell necessarily that someone's got
Yeah,
these devices on or that they're running. And I think, obviously that we live in a very much surveillance society, so we're always being surveilled wherever we go.
yeah,
It's just something that people accept. But then there are private spaces or situations where people feel that their privacy their right to privacy is impacted by those devices, whereas that's someone's right to equity. So that there are sometimes when human rights come into conflict with two different user groups, and we have to manage that. We have to make sure that we've got safeguards for people, but also we enable equity and equality of access and stuff. So it's becoming more and more difficult, and because of the new technology that we just don't have policies for, or no one ever saw that coming. In terms of
yeah.
managing those potential conflicts of interest. But we need to work on them. We need to look at them because we don't want to inhibit the usefulness of these devices because we're worried about something that we can maybe manage that worry out. But again, it isn't always easy, and sometimes these things can take quite a long time. But I think we have to deal with these things because they're real and present. So we haven't. I mean, sometimes we don't, or we're not on the front foot with these things. But I think the more these issues come up, I think the more we need to start looking at them in partnership with other sight loss charities like RNIB will be thinking about this as well, I'm sure. Possibly Guide Dogs and other charities. So we need to have a sector response really, rather than all of the charities just dealing with it themselves and then spending all of that time. Now RNIB have a good legal team. We don't have a legal team. So in terms of some of that side of things, RNIB will have that access to legal advice to deal with some of the potential legal conflicts between these two areas. So that would be quite useful actually. So I'll mention it to RNIB actually and see if they have done anything in that space, because I bet they have. I'm just not aware of it.
Yeah. No, that's brilliant. Thank you. Just conscious of the time. It's a few minutes past 8 p.m. Well, thank you very much, Eamonn, for joining us and just giving us such a comprehensive overview of TPT and the amazing work and support services across all sorts of things from health to education and employment. It's been absolutely fascinating, and I've learned a lot, as I'm sure many of us that are joined this evening, and those that will be tuning into the audio recording when we've uploaded it to our YouTube channel. So thank you very, very much. I don't think we've got any other questions. Does anyone have any final thoughts for Eamonn before I quickly wrap up with a few notes from Retina UK before we close the meeting down and you all can enjoy the rest of this sunny evening?
No, no one's waiting.
No. Well, just a couple of points from Retina UK. First, if anyone is available to join us for our professional and annual conference in September, it will be held over the 18th and the 19th, and the 18th being our professionals conference, followed by our annual conference on the 19th. They both start around 9 o'clock and they finish around 4:20 p.m. Please come along. It's going to be in Birmingham this year at the Edgbaston Park Hotel and Conference Centre. Full details is available on our website. Also, we did include the registration links in the invitation email, and you'll find that underneath the "you may also be interested in" section. Just a few peer support groups coming up next week. Online, our Talking Travel, we have Laura Cross from Guide Dogs talking about a new mobility initiative that they are rolling out to support local mobility and rehab officers. If you are struggling, like Eamonn said, to get a rehab officer to help you with your cane training, and other services. So they are going to be talking about this amazing initiative that's going to be rolled out across all of the UK. So please come and join that. That's from 7 p.m. on Thursday, the 23rd of July. Also, our women's peer support group is on the 28th, which will be focusing on mindfulness and well-being. That is also at 7 p.m. as well. I think the other peer support groups we've got coming up are our local ones across Dorset in the southwest on Tuesday, young adults peer support group on Wednesday, that's online at 7 p.m. and then we've got a couple of in-person peer support groups next Saturday, West Midlands and Berkshire as well. All of these are available on our website, and also at the you may also be interested in section as well. If anyone has any questions that they can think of after the meeting, please forward them over to me and I'll forward them on to Eamonn as well. Or if you have any questions regarding our services or you want to get in touch, then please call us on our helpline 0300 111 4000, or you can email us at helpline@retinauk.org.uk, or contact me at services@retinauk.org.uk as well to find out more about our services. Thank you, Eamonn, for joining us this evening. It's very, very much appreciated. Thanks to Caroline that's supporting with the technical side of things of Zoom. My name's Mark Baxter. I'm the Information and Support Coordinator. We really do appreciate you joining us this evening for our National Summer Peer Support Group meeting. We will be back in the autumn towards the end of September, early October for our autumn meeting. So please keep an eye on your emails for what we've got planned for that one. Any ideas or any topics of conversation, please do forward them over to me. I always are interested in your thoughts and feedback and how we move forward with our peer support groups. It's very vital for us. So thank you, everybody. Enjoy the rest of your evening and the rest of your summer as well. Please stay safe, stay hydrated, and we'll see you again soon. Take care and all the best.
Yeah, thanks very much, Mark and Caroline. Thank you, Eamonn. Very informative.
Thank you. Bye.
Thanks, everyone.
Thank you. Take care, everyone.
Bye-bye.
All the best.
Bye.
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 We hope you've enjoyed this Retina UK peer group recording. If you have any questions or queries regarding its content, or you would like to leave us some feedback, then please do get in touch. You can contact us via our helpline on 0300 111 4000. Call the office team on 01280 821 334, or alternatively, you can contact us via email at services@retinauk.org.uk. If you are interested in creating your own peer support group and assisting Retina UK to grow our peer support group network and join our amazing team of volunteers, then please do get in touch by contacting us at info@retinauk.org.uk and speak to a member of staff to see how you can get involved. Thanks again for listening, and please stay tuned for more peer support group recordings coming throughout this year. Take care and all the best. Bye for now.